Hi, it's Asia. Welcome back to my YouTube channel. I am making a video about the medical assistant exam given by the AAMA. This is my second video about this topic because I think that in my first video I didn't give enough information. I was really stressing to know your vocabulary and know your medical terminology. However, I do think that I could be a little bit more helpful with this book and just let you know how I used it, how I studied, and hopefully give you a little bit more information. So let's go ahead and get started with the book. Before I get started, I did want to let you know that there's a test in the front of the book, a test in the back of the book, and then there's tests after each chapter, which I thought was pretty cool because that way it helps you review and know where you're at and what you need to study a little bit more. So in the beginning, it has a diagnostic test, and that just kind of gives you an overall overview of the entire test and kind of lets you know what you may need a little bit more practice on. After the test, it tells you what chapter to review. So it gives you the subject and then it tells you the chapter to review. Which is really helpful because that way you can go ahead into the different chapters and review. The first chapter, or the first, chapter that you're actually going to study is going to be the medical terminology chapter. And how I use this book is, well, first, when I first started studying, I had a big stack of index cards, flashcards, with all the different terms on them, and I was like, this is not gonna work. So what I would do is, at the end of the day, when I was laying in bed and going to sleep, I would literally sleep with this book glued to my face, and I would just go over these words over and over and over and over again. So after that, after medical terminology, you have anatomy and physiology. I really focused on anatomy and physiology, not only because it's really interesting to me, but because I figured that there would be more anatomy and physiology questions on the test than anything, since it's a medical assisting test. And knowing that terminology is important too. It also, on the test, it does ask you about planes in the body, different cavities. It also goes through body systems. It's going to ask you questions about the muscular system, the integumentary system. Sorry, I always have a hard time saying that word. All the different systems, urinary, reproductive, nervous, all that fun stuff. So I did, because I'm extra, buy these on Amazon, and they're really cool. I just don't think I needed them. They're like really huge, poster size. This one's probably my favorite because I like the heart. I really like the heart. But I heard cardiologists are not fun to work for. That's what I heard. I don't know. Let me know if you've worked for a cardiologist and if they were cool or not. But anyways, okay. So I got those because I'm extra, and they were kind of helpful. I should put them up in my room. I really should. So yeah, it talks about the eye, the inner ear. Don't worry about EKGs and knowing like the PTQRS waves, because none of that is on the test. Definitely go through all the systems. All the anatomy and physiology is very, very important. Nutrition is going to be your next chapter, and it's important to go through the nutrition, knowing your vitamins, things like that. knowing different diets is important. There is a question on, I do remember this question directly from the test. And it says, a patient who has diarrhea may benefit from which diet? A, soft food, B, DASH, C, brat, D, lactose free, or E, vegan. So I do remember that exact question from the test. So, if that question is exactly from the test, then there's going to be other questions that are in this book that are going to be on the test. And so this is a good review tool, and I definitely recommend taking the tests after each chapter. Okay, the next chapter is going to be psychology. And there are a couple questions about it, about maybe childhood development and developmental psychology and the different theories, but there's only like one or two questions on that, so I wouldn't wreck my brain like going crazy about knowing that. Just skim over it. You know what I mean? Like, you don't have to hammer it into your head. The anatomy and physiology, medical terminology, hammer that into your head. Patient communication. This just talks about, obviously, communicating with patients, different cultural differences, nonverbal communication, having empathy, blind and visually impaired patients, dealing with children, things like that. Let's see, what else we got here. Professional and legal knowledge is the next chapter, and this just goes over medical law, malpractice suits, medical records, a lot of HIPAA information, healthcare obligations, things like that. Next, the most boring, office administration. Okay, so this just goes over making appointments, progress notes, record management, HIPAA, all that fun stuff. All that really boring stuff. I don't like front office, if you can't tell already. Let's see. Policies and procedures. Again, boring, boring, boring. Office equipment, office documents, blah, blah, blah. Next chapter. Financial management. And that just talks about, obviously, different insurances, TRICARE, Medicare, Medicaid, things like that. Billing, it shows you super bills or charge sheets, whichever you want to call it. Different coding, preparing charts, things like that. Next is patients in the clinical setting. That is an important chapter because it talks about patient positioning, which is important. Sterilization, temperatures, vitals, arteries, things like that, giving injections, pulse points. This is a very important chapter. Chapter 12, patients in the clinical setting. Like I said, it does talk about patient positioning, which is important. There are questions on the test about patient positioning for sure. Lab work. You know what? There actually weren't that many questions on lab work on the test, which was surprising. And I was like racking my brain to learn the order of draw, which I still don't get. But there was not one question on the order of draw or the angles that different injections go in, which was like, what? Let's see. In lab work, there's a lot of information. Like, see, I was like going crazy with my purple pen. There's a lot of information about different ranges that things are supposed to be in: hemoglobin, hematocrit, HbA1c. Did I say that right? Yes, I did. Fasting blood sugar, cholesterol, kidney function, creatinine, things like that. So it does, I would read over this information. I would not, don't worry about how I was doing, like writing down the the ranges and like things like that, like how I was writing the ranges. Don't worry about that because it doesn't get that specific on the test. Um, let's see what else. Medications, pharmacology is very important to know what different schedules, like classes, or they're called schedules, drug classification schedules. um, that's important to know, and um, classifications of drugs, knowing what type of drug does what. So that graph is an important one. I hope you can see these. Um, Different forms, whether they come in powder or pills or liquid or things like that. Just understanding information about that. Minor surgery is the next chapter, and that's really just talking about informed consent and mostly asepsis, like taking care of cleanliness. And also, it shows you a few tools, some tools of the trade. And let's see, it talks about the suture removal, wound healing, the role of the medical assistant. Let's see, it also talks about emergencies, it's chapter 16. So that just talks about different bleeding, chest pain, CPR, poisoning, seizures, things like that. And then that is, oh no, wait, there's one more chapter, emergency preparedness. So a lot of that is just common sense. But I would just skim through it. I actually read like every single word in this book. Um, it's worth it. It's worth it because if that's your goal, then you got to do whatever you got to do to reach your goal, right? Um, so yeah, at the end of the book, there's the practice test, which I never timed myself. And after the test, or like when I took the test, I definitely had plenty of time left. So I wouldn't stress about how long you're going to take because you should have additional, like extra time. Because I'm a pretty slow test taker. I go back and I look at different my answers over and over, and I read questions over and over. So I'm not a really quick test taker, but there was plenty of time left over. So I wouldn't worry about that too much. However, I will, let's see. I think I'm done. I think we're done. I will link the AAMA website below. And oh yeah, speaking of the website, you're going to go to CMA exam at the top of the page, and there's a drop down menu, and you're going to go to, let me see if this lets me in, study for the exam. And then there's a content outline there, and go ahead and print that if you'd like. I mean, it's really dense. So it's like 6 or 8 pages of single spaced outline. So the thing is, it was a little bit overwhelming for me. I would go through and check things off, but it was just too overwhelming. I would just go by the book, make your own outline from the tests that are in there. Um, there's also a practice exam on the website. However, you have to be a member, and I think that you have to pay for a membership to have a membership. So, yeah, I never took the practice exam online. However, you may want to. So, let me know how you did on the exam, and let me know if you have any questions. Let me know if I forgot anything, or if there was anything that you may want to know additionally. I'm open to questions. I respond quickly. So, yeah, hit me up. All right. Bye.